More violence prevention programs and unarmed responses in addition to police. Those are the top takeaways from a new public safety plan for Minneapolis put together by Harvard University researchers. Tonight, the Minneapolis City Council met to discuss the plan. Kaya Edwards has their reaction and a look at the current crime data to put it all into context. Kaya?
Julie, according to public crime data from the Minneapolis Police Department, several areas are on the rise, several others are going down this year compared to last year. For example, car thefts are up nearly 70%. Destruction, stolen property, sex offenses, weapons violations, and assault are also on the rise. But meanwhile, carjackings are down almost 46%. Gunshot wound victims and homicides are each down around 35%. Also decreased are shots fired calls, robbery, non-vehicle theft, burglary, and domestic assault. Tonight, people who work to improve the stats are sharing their perspectives and response to that Harvard report.
The 143-page Harvard University report on Minneapolis public safety can be summed up in 2 words: more collaboration. Its lead researcher presented the plan to a council committee, recommending an ecosystem of police, public health, and human services workers respond to community need.
But it's sad that it took the Credential Harvard's report for us to be like, well, maybe tens of years, decades of years, Black people were right. Brown people were right about what we need for our public safety system.
Community groups sticking around to the end say they are mostly optimistic.
We need to come together. This roadmap is going to help with some of the healing and reconciliation.
Howard Dotson is founder of Twin Cities Crisis Response Team.
I've shared their frustration of they've seen this for a long time and they've been waiting for results. There's folks overdosing in that one parking lot, Merwin Liquor, Lindell and Broadway, 14 overdoses in one location. That was last September. For 10 months, we've been asking for opiate settlement money to be dispersed and committed to get free Narcan out in the community. This roadmap will help us, and it's going to take community partnering.
I really like the idea of this co-responder model.
LaTanya Reeves is chair of Minnesota Civilian Public Safety Commission.
I do believe we're getting better with that, and the fact that we have the 311, people can use that within the city limits, and they can call outside the city limits with a different number, but really saying, okay, we'll have different responses. I do believe more collaboration is needed. The people that are in the community are the ones that know their community best, and so the city partners, the enterprise, need to really work with those people that are boots on the ground.
All right, so while some optimism and urgency does seem to be there, the Harvard researcher rated the city's financial readiness to implement the recommendations a 5 out of 10. He says city executives need to bring an investment plan to council ASAP, and says that's when we will see if the city really wants to move forward with this. Julie?